The Ebola crisis continuing to make headlines today as we've learned the city of Dallas is considering a disaster declaration to deal with the problem.
And now a second Ebola patient is being moved from Dallas to a specialized facility in another part of the country.
News Channel 5's Chris Conti has the latest for us.
26-year-old nurse Nina Pham is being transferred tonight from the hospital in Dallas where she caught Ebola to the National Institutes of Health in Bethesda, Maryland. It's one of only 4 facilities in the U.S. specially equipped to handle viruses like Ebola. Emory University Hospital in Atlanta is another. 29-year-old nurse Amber Vinson was moved there last night to be treated for the disease. Hazmat crews continued decontaminating her apartment in Dallas today. Pham and Vinson were on a team of about 75 healthcare workers who cared for Thomas Duncan before he died last week. Duncan's fiancée says an executive from Texas Health Presbyterian called her today and apologized. The official told her the hospital was, quote, deeply sorry they couldn't save his life. So far, no one Duncan stayed with in Dallas has gotten sick. We've also learned the identity of the man with the clipboard who got within several feet of Vinson while she was being transferred yesterday. The man, who was not wearing protective gear, is a medical safety coordinator with Phoenix Air. A company executive tells CBS News the safety coordinator does not wear gear so he can act as the team's eyes and ears on the tarmac, and that they're trained to keep a safe distance from patients. Phoenix Air says it has transported 11 Ebola patients and no crew members have caught the virus. And tonight we can tell you Connecticut's Yale New Haven Hospital is evaluating a patient with Ebola-like symptoms who was admitted just last night. The patient is a research student who returned from Liberia on Saturday. Jessica.
All right, Chris, the United States response to the virus came under fire during a congressional hearing. News Channel 5's Andrea Klein-Thomas tells us what the CDC has to say that affects families right here at home.
And members of Fort Campbell's 101st Airborne Division are headed to Liberia, the West African country with the worst outbreak of the Ebola virus. Congressional leaders specifically asked the CDC if our troops will be safe.
Dr. Frieden, I want to come back to you.
During hours of congressional testimony, Tennessee Representative Marsha Blackburn put it plainly.
Are the American troops going to come in contact with any Ebola patients or with those exposed to Ebola or included in any of these controlled movement groups?
CDC Director Tom Frieden explained that troops will not be in direct contact or have to care for patients diagnosed with Ebola.
That said, we would always be careful in country because there is the possibility of coming in contact with someone with symptoms and being exposed to their body fluids, and that's why the Department of Defense is being extremely careful to avoid that possibility.
You may now go ahead and turn to your battle buddies. Double check each other one more time.
Soldiers with the 101st Airborne Division are training to fight the Ebola pandemic in Liberia.
A number of people have asked me why we are being sent to Africa. What could we possibly do in containing a pandemic?
700 soldiers from Fort Campbell will help contain the spread of the virus by training healthcare workers and establishing logistical centers.
So do you have a high level of confidence that they're protected?
Congress expressed concerns about their safety.
I would not say that there's zero risk. They are in those countries, but they are not participating in high-risk activities.
Like all military missions, there are no guarantees. But the CDC director stresses if the disease is not contained in Africa, it will become a threat to the U.S. healthcare system.
If you want the job done, call on the 101.
Now, the focus was also on how to keep the virus out of the United States. Coming up at 5, we'll tell you why the CDC says imposing travel restrictions, why that will be difficult. Vicki?
Thanks, Andrea. Well, as you know, there are no reported cases of Ebola in Nashville or Tennessee, but to make sure Tennesseans stay informed, the Metro Public Health Department held a community meeting. News Channel 5's Jonquil Newland was at that meeting this afternoon and joins us live with more. Jonquil?
Good evening. The last time a meeting like this was held was in 2009, and it was to inform the public of the H1N1 virus. Now it's all about Ebola. Health experts say their biggest concern is in ongoing outbreaks that are not contained in West African countries. Now, since 1976, there have been 23 Ebola outbreaks in Africa. There are no vaccines or approved drugs to fight the virus, so the best way to combat a growing outbreak is to contain the virus. Now, this afternoon, health officials here went over facts like how the virus spreads and who can get it. Ebola does not spread easily and can only be contracted through direct contact with body fluids of a person who has the virus. Now, that does include include sweat. In West Africa, 7 out of 10 people with Ebola die from it, but health experts in the U.S. are confident early detection and medical care will keep that from happening here.
The chances of any illness in Nashville being Ebola right now is 0. Flu will kill more people than Ebola in this country.
Now, 30,000 Americans die from influenza every single year. However, health experts are taking this Ebola threat extremely seriously. Tonight at 5, we'll hear why the Ebola threat continues to grow throughout the U.S. For now, live outside the health department, I'm Jonquil Newland, News Channel 5 HD.